Hi, welcome to this lesson on interpretation of pediatric elbow radiographs in the setting of trauma. There are 4 interpretation basics. First, adequacy of elbow radiographs. Second, gross overview assessment. Third, methodically analyze radiographs. Fourth, assess for soft tissue abnormality. For an elbow radiographic exam to be adequate, at least frontal and lateral views are necessary. This slide demonstrates normal frontal and lateral views of an elbow. Next, gross overview assessment. To assess for gross fracture, gross malalignment, and gross soft tissue injury. Next, methodically analyze radiographs, assess elbow ossification centers, assess for joint effusion, assess alignment. CRATO is a common mnemonic for the order of appearance of elbow ossification centers and stands for capitellum, radial head, internal epicondyle, trochlea, olecranon, and external epicondyle. These elbow ossification centers occur at relatively predictable ages 1, 3, 5, 7, 9, and 11, respectively. This slide demonstrates frontal and lateral images of an elbow with the elbow ossification centers outlined. Next, assess for joint effusion. This slide demonstrates normal frontal and lateral views of an elbow. Note on the lateral view, there's a small anterior fat pad along the elbow, which is normal. On this lateral image, there is a large anterior fat pad indicating an elbow joint effusion. Also on this image, there is a posterior fat pad indicating an elbow joint effusion. The anterior and posterior fat pads are indicated by the blue markings. Next, assess alignment. The anterior humeral line is drawn only on the lateral view. The anterior humeral line is a line drawn along the anterior aspect of the anterior cortex of the distal humerus and should intersect the middle third of the capitellum ossification center. The radiocapitellar line is drawn on all views and is a line drawn through center of radial neck and should always intersect the capitellum ossification center. This is an example of the anterior humeral line. The capitellum ossification center is indicated by the light blue marking. This is the anterior humeral line with the light blue marking indicating the capitellum ossification center. Note that the anterior humeral line goes through the middle third of the capitellum ossification center. This slide demonstrates the radiocapitellar line on frontal and lateral views. Next, assess for soft tissue abnormality. This slide demonstrates normal frontal and lateral images of an elbow. A search pattern checklist is a useful tool. For the pediatric elbow radiographic exam, the search pattern checklist should include 1, initial gross overview assessment, 2, evaluation of ossification centers, 3, evaluation for elbow joint effusion, 4, evaluation of anterior humeral line and radiocapitellar line, and 5, evaluation for soft tissue abnormality. If search pattern reveals normal findings, evaluation of pediatric elbow radiographic exam is complete.